So, the challenge we are faced with now is to identify problems that could potentially be addressed or need health management, and to briefly describe the role of OT. The goals for health management and maintenance. I'm going to now describe each one of these that are bolded. Our goal is to perform assessments for health risks related to potential falls, safety and independent living, and cognitive memory screens in older adults. To teach strategies to incorporate healthy habits and routines into daily activities. To identify solutions to personal and environmental barriers limiting clients from engaging in healthy activities. To educate about the importance of relaxation and rest to achieve balance between work and leisure. To teach relaxation techniques. And to provide skill training in areas such as socialization, caregiving, parenting, time management, and stress management. The importance of physical activity. It's so important for health, well-being, and function, decreased mortality, and injury prevention. So what is the evidence? Results of a systematic review of the literature on occupation and activity-based health management and maintenance interventions for productive aging include moderate to strong evidence that client-centered occupational therapy improved physical functioning and occupational performance related to health management in community-dwelling older adults, as well as older adults with osteoarthritis and macular degeneration. Moderate evidence was found for health education programs that reduced pain and increased physical activity, and that individualized health action plans improving activities of daily living and participation and physical activities. The evidence that self-management programs results in a decrease in pain and disability, and that incorporating cognitive behavioral principles into physical activity improves long-term participation in exercise was also moderate. Although the evidence for skill-specific training in isolation is limited, effectiveness increases when skill-specific training is combined with health management programs. The influence of technology on health management strategies. Improving medication management, home INR and blood sugar monitoring. INR is a prothrombin time test measure, measuring how long it takes for a clot to form in a blood sample. And INR is a type of calculation based on different test results. Influencing technology and health management strategies also looked at home blood pressure monitoring, cardiac and pacemaker monitoring, lab on a chip, such as blood values and metabolic values, and things such as pedometers, accelerometers, motion and activity trackers. Medication management. Compliance and adherence are key issues. Different factors contribute to non-compliance, such as finances, poor understanding, changes in regimen, cognitive deficits, psychological factors such as depression, inadequate follow-up or discharge planning, poor provider-patient relationship, missed appointments, complexity of treatment, side effects of the medication, or patient's lack of belief in the benefit of treatment. And then there are different medication management systems that we will go through. I like this graphic to describe the self-reported reasons for non-adherence, and the link to where I got it is below. So look at about 42% of individuals who had non-adherence with their medication management routine said that they forgot. 34% said they ran out. 27% said that it was away from home, that they were away from home. 22% said they were trying to save money. 21% said that it had side effects. 17% said that they were too busy. 17% said that the prescription wasn't working. 16% didn't think the prescription was needed. So that shows a lack of insight. and 12% said that they did not like taking the medication. There are different ways to measure adherence to medications. You could do pill counts, which is literally counting the amount of pills that are left once someone says that they've taken the medication. Rates of prescription refills. So that requires a closed pharmacy system, and an electronic medical record. Have patients keep diaries or electronic medication monitors. Please review this graphic independently. Think about all the different levels that we can intervene on to promote medication adherence. There are different ways to overcome unintentional non-adherence, meaning the person isn't intentionally not taking their medication. Maybe it's those people who forgot or financially couldn't afford it, or they had poor cognitive skills impacting their organization. There are packing interventions that are cost-effective, such as pill boxes or blister packs that you could see in these graphics. And then, of course, it's OT's role to help individuals integrate medication taking into their existing habits. So how can there be different behavior prompts to aid in that memory? An external aid, such as a phone alarm or a medication log. There's so much technology out there today by just saying like, hey, Alexa, or hey, Siri, remind me to take my medication at such a time, that they can improve their medication management. So this graphic shows the impact of social support on medication adherence. So percent saying that the pharmacist or staff knows you pretty well, dependent on the type of pharmacy. So 36% say that the pharmacist knows them pretty well is through mail order. So that's a system where the medication gets sent to their home, which has its own benefits if the person is not able to get out to their pharmacies. 67% said through a chain pharmacy. And then look at that improvement in 89% saying the pharmacist knows them well through a neighborhood pharmacy location. So strategies to improve medication adherence. The first step is identifying the poor adherence, doing some type of assessment to recognize that the person is not adhering to their medication routine. Enhancing communication between the physician and the patient. So shared decision-making, collaborative approaches to involve the patient in medical decisions. Cognitive behavioral strategies. However, adherence is typically not sustained after this intervention is withdrawn. Self-monitoring of symptoms can enhance adherence. Multifactorial approaches, which shows that a single approach will not work for all patients. Patient education, reminder cues, improved dosing routines, behavioral interventions, and social support through pharmacists and family. Health management wearable devices. There are things called hats for EEGs, which detect seizures, watches for cardiac arrhythmias, socks to detect ulcers or gait abnormalities. Now, the challenges with these wearable devices are the usability, accuracy, battery life, and need for technical support. However, they do promote greater responsibility in one's own care management. So what are the possible uses for such devices? Vital sign monitoring, chronic disease management for glucose levels or weight loss, fall detection. So I know we've all seen those commercials of the I've fallen and I can't get up, the life alert, the 24-hour alert, they all have different names, and sometimes they are covered by insurance. So some of those devices have gotten so high tech that someone could have a fall and the device itself, being this little thing they maybe wear on their wrist or around their neck, detects the fall without them even having to press a button. Pain management or abuse, wound care, and heart failure. This is an example of a glucose monitoring system. You can see there's no physician involved at this level of the intervention. The individual is performing it themselves to monitor their glucose level. Of course, this takes medical guidance on how to set this up initially, but then the person can monitor it themselves. Health information technology. It involves the processing, storage, and exchange of health information in an electronic environment, like I was discussing earlier. The widespread use of health IT within the healthcare industry will improve the quality of healthcare, prevent medical errors, reduce healthcare costs, increase administrative efficiencies, decrease paperwork, and expand access to affordable healthcare. It is imperative that the privacy and security of electronic health information be ensured, as this information is maintained and transmitted electronically. Emerging technologies will play an increasing role in supporting older adults' preference to remain in their homes for as long as possible. Technology that promotes elders' ability to live independently in their homes and communities include patient safety monitoring technologies, like I was discussing before, that fall detection and prevention and location tracking, assistive devices, and modifications in the home or residential environment. These technologies help reduce in-home accidents, a major source of disability and death for older adults. Falls are the leading cause of injury in older adults older than 65, and more than a third of this population falls each year in the United States. Advanced technologies for monitoring movements of older adults are increasingly helping to identify those most likely to fall or those who have fallen, allowing for increased prevention and more timely assistance. Here's just a graphic to show how widespread health information technology can be. You'll discuss more about smart homes in your lecture about home modifications, but just to put in here that smart homes monitor everything from a person's whereabouts and activities, medication assistance, security, physiological parameters, such as, like we were saying, those vital signs and activity levels, and fully automated systems for communication and leisure activities. Older adult attitudes toward health technology definitely impacts the way that they'll be able to implement these interventions. One might think, what would be the concerns of health technology? How has this changed since COVID-19? Studies show very favorable results with some concerns regarding perceptions and expectations. Usefulness of devices and sensors for fall prevention, visual or hearing impairments, mobility concerns, decreasing isolation, monitoring physiological factors, improving mobility and medication management, and positive attitudes and benefits for emergency health monitoring systems. Some of the concerns about technology that older adults have are the user-friendliness of devices, the lack of human response and need for tailored training for older adult learners, the reduction of social contact, the substitute for personal forms of care and support, or that they'll become over-reliant on these automated types of systems. Now, you want to think, how might we support individuals using this technology? Technology has the potential to support independence of aging in place. Technical or organizational, ethical, and policy, all being impacted by health technology. And promote, sometimes these technologies that we implement can promote dependency rather than supporting independence. So we just need to make sure that we're always promoting more independence if that's the person's goal. Here's a summary of what I was just talking about. So some thoughts on health technology. Does this promote over-reliance or dependence on the technology? How will that lack of human support or contact impact that older adult? Does this promote dependence versus independence? It's part of a changing society that we need to embrace, or we might be left behind a little bit of, when things are changing. A perfect example is the iPhone, how much that has changed, even how we book medical appointments, how we grocery shop, etc. Will this help us prepare for an older generation boom? Meaning, are we able to serve more older adults in a shorter amount of time, letting us care for more people? How does it foster aging in place successfully? And addressing issues promoting health management and maintenance and health promotion and wellness. On the next few slides, I want you to do some independent practice with case studies. Come to class ready to discuss any questions you might have about these different case studies. For each of the following cases, identify what areas of health management or maintenance may be areas of concern. Determine how you might intervene as an OT, and consider the resources, technology, or recommendations to address for these areas of concern.